Tonight, the Empire State Building in New York City is lit up red as all across the country today, communities are honoring the more than 400,000 lives lost to COVID. Joining us now, Dr. Alex Garza, commander of the St. Louis Metropolitan Pandemic Task Force, to answer your questions about the vaccine. Now, earlier we mentioned that St. Louis County today received 3,900 more doses. I asked Dr. Garza about supplies outside St. Louis County.
Outside of St. Louis County, so we don't have information for the other counties yet. So typically we discuss that later on in the week. Now, I will tell you, though, that just in general, the supply for the state of Missouri is very limited, specifically also within our region.
We have a viewer question. Jody in Baldwin wants to know what happens after you register, asking if the vaccinators are going to text you, email you, phone you.
There's a couple of different processes, and it depends on which healthcare system it is or whether it's the health department. So what SSM Health is doing, which is what I'm most familiar with, is we're using sort of our internal patient charting activities, so we can push messages out to our patients to say, hey, now it's time to schedule you for your vaccination. The St. Louis County, they're registering the names, and I believe they're pushing it back out in either a phone call or an email as well to say, hey, now it's time for you to schedule your vaccination. But it can be any of a number of mechanisms. It just really depends on who you've registered with and what process they're using.
Well, once people receive the vaccine, can they still spread COVID?
Yeah, so that's an interesting question, and it's more of a biological theory question, I think, more so than practically. So, and the reason why I say that the vaccine, the end results for the research on the vaccine was really to determine if it could prevent serious illness. And they did that by, tracking signs and symptoms and who got admitted to the hospital and, of course, who died. But it doesn't really track if you were ever infected or if you were infectious. So you could produce, theoretically, an antibody response to prevent you from getting sick while still having the virus and still being able to transmit it. It's just that you're not getting sick. So that's why we recommend that people, even if they get immunized, to continue to practice all of those mitigation strategies, such as wearing a mask and social distancing.
We got a question here. People wanting to know about their college kids, younger people, kids at home as well, and when they might be able to get the vaccine.
The populations that are eligible for vaccine right now are that 1A, which is healthcare workers in long-term care and nursing homes, that 1B1, which are first responders and law enforcement and people like that, and then that 1B tier 2 category, which is very big because that's all of the people that are 65 and older or in between 18 and 64 with a health condition. And that is a large percentage of the population. So how fast we can get those populations immunized is really dependent upon vaccine amount. Now, if we have a very limited supply of vaccine, it's obviously going to take us longer to get through 1A, 1B1, and 1B2. If we get more vaccine available, then we can create more vaccination sites and we can get people through quicker.
Another question here from a viewer, Nina in Troy, Illinois, wanted to know any statistics of people who are diabetic and how they have tolerated or reacted to the vaccine.
I haven't heard of anything specific about diabetics, and there haven't been any cautions for diabetics about not getting the vaccine. Now, we do know that diabetics places them at a higher risk for severe disease from COVID-19. And so those are one of the populations that does have a higher priority.
Another question that's coming in from Leo in O'Fallon, Missouri, says his wife is paralyzed. It's hard for him to take her places. Will someone be able to come to their house and give her the vaccine?
We believe so. Those haven't been finalized yet. We're in discussions right now on how can we get more mobile teams out into the community to do vaccinations for just those reasons that you mentioned.
Coming up next, minority communities have been hit hardest by coronavirus. Despite that, many people have worries about vaccines. Tonight, why doctors are urging people to trust the science.